in general, it's a massive health problem. Air pollution alone, it's estimated to cause 7 million deaths annually. And I don't know if you're familiar with the figures of global health mortality, but this is a lot. And also, if we take into account other sources of contamination, so not only air pollution, but we also include soil or our water pollution, this figure rises up to 9 millions. As I know, most of the audience doesn't come from the public health sector, so I have included a slide here that shows which is the magnitude of these figures compared to other important causes of mortality. So as you see here, total pollution causes same number of deaths annually that one of the most important health risks, which is smoking and secondhand smoke, and much more deaths than other important causes of death globally. Maybe some of you, when you closed your eyes, didn't think about environmental contamination, but you thought about climate change. Again, climate change, it's not only an environmental problem. I'm sure you're all aware of that, but it's also a public health problem. And in fact, we could say a health crisis. No, it's related to a health crisis. There are multiple factors through which climate change is related to human health. Some of them are very easy to understand, such as the health effects related, for instance, to extreme weather events. Probably you've been following the news in the last weeks, and you saw the disaster happening in Valencia, a few weeks ago, related to the heavy rains and floodings. This is something very straightforward to understand. No, climate change increases the number of extreme weather events, and this has a direct impact in our health. There are other effects related to climate change that also affect our health that are explained through more complicated pathways. Some of them mediated by biophysical or biochemical pathways, such as, for instance, the increase of certain diseases, such as the ones transmitted by vectors. No, some vectors can spread to regions before they were unable to live, such as the mosquito transmitting dengue or malaria. And due to climate change, the increase of the transmission and the incidence of these diseases is increasing. And even we have a third level of complexity when thinking about climate change and health, and it's all these causes that are explained through social factors. No, we can think, for instance, all the physical and mental health effects that violent conflict or migration related to climate change has in human people, well, in human health. I think it's always good to give some figures, although I won't have time to go into the details in this presentation, but you will see that I've left some slides with references for you to revise in your own time if you're interested on this topic. I just wanted to give a specific example of the first pathway that, as I was mentioning, you know, the one that the direct effect of climate change in human health. And this is a very nice example published by a colleague in IS Global, in which they estimated the number of deaths occurring in last summer in Europe, just related to increased temperature. So we could go through different environmental exposures and try to identify the links between environmental degradation and human health. We could do that for 1 or 2 hours if we had time to do it. But the important thing is to understand that environmental degradation as a whole is related to human health. If we have a look of what had happened in the last decades to our environmental, no, to the planet Earth's systems, we see that we have experienced a massive degradation of different systems. And this has put us, or this is conducting us through the Anthropocene. No, the Anthropocene, I'm sure you're familiar with that term, has been proposed as a new geological era in which human activities have been so strong that they have had significant effects on Earth systems. And how is this linked to human health? To understand that, it's important to refresh the concept of the Holocene and what has characterized the Holocene. Well, the Holocene is this epoch. The Holocene has been characterized by a super stable climate, which has led to a very stable dynamics of Earth's natural systems. No? And this has been this stability that has allowed a very mild temperature on planet Earth and having predictable seasons that allowed human beings to establish in the great civilizations that have allowed to improve health and well-being globally. If you see the trends in temperature in the last 10,000 years, you see that temperature has been it has been varied until when we reach the Holocene, in which, as I said, it was very stable and never overpassing 1 degree above pre-industrial temperature. So leaving the Anthropocene, leaving the Holocene and entering the Anthropocene is with the associated increase in global temperature is putting us as a species in a completely unknown situation. So we know that we as Homo sapiens and we as humans in the civilizations that we know have been very successful to prevent, to improve our health in these conditions, but we don't know how we will be able to adapt to a new situation. And not only this, but we don't know, and more important than that, we don't know how planet Earth will behave in that new situation. With this concept in mind, in 2009, a group of scientists led by Johan Rockström proposed the concept of planetary boundaries. They identified 9 systems that were the responsible of keeping planet Earth in that very stable state in the Holocene. That I repeat that because it's important, that it's the only state in which we know that we as Homo sapiens can live on planet Earth in a healthy way. No, and they define a numeric value for one of these systems to define a safe operating space. No, the space in which we know that health systems work in the same way as they have been working in the Holocene, and therefore the space in which we know that we can live as humans and thrive. According to the last evaluation that they did in last year, 6 out of these 9 boundaries have been crossed, and according to a paper published just a few weeks ago, it looks like the boundary of the ocean acidification is likely to have been crossed. So we are departing from this safe operating space. So it's not only linking each specific environmental risk to human health, is understanding that we are moving to a new space in which we don't know how the environment will behave, and we don't know how we will adapt to this new situation. Just a parenthesis, if this concept is new for you, I recommend these 2 materials. The first one is a revision of the original paper on planetary boundaries, in which they include the concept of justice, which is, I assume this will be very relevant for the audience of the school. And then this documentary on Netflix, which links very well each of the boundaries with human health. Okay, so what had happened to human health during this period? No, we said that in the last decades, the state of the environment has been eroded. But what had happened to human health? Well, we see that in the last decade, and especially from 1950, some of the indexes that we use in public health have improved, and this could probably explain, among many other reasons, the lack of involvement so far of people working on public health with all, no, with all the environmental problems and the environmental crisis. Probably some of you might be thinking, okay, you've been already talking for more than 10 minutes about the importance between the environment and human health, and now what we see is that the temporal trend don't correlate. So we've been eroding the environment, and at the same time, human health has been improving. Well, this explanation for that is straightforward, and it's the improvement in health over the last decades have been achieved through an overexploitation of resources. No? So we've been able to improve our health by exploiting the natural systems. However, we reached a point, and as I was just shown in the previous slide of planetary boundaries, we reached a point in which this strategy is not longer valid. Because if we continue this same trend, we are putting our health at risk. And it's not that we are compromising the health of future generations, as I had written in my slide, but we are compromising our health, the health of our generation. And it's in this context where the concept of planetary health arises. No, it's the current concept of health does not take into account whether the health gains are achieved at the cost of eroding the Earth's natural system. No, somehow everything was valid to improve human health for many years. No one was considering if that was acceptable or it would have long-term effects. But we are not in this phase anymore. And this is what planetary health is about. Understanding that to improve human health, we have to do it in a way that we are also protecting the health of the environment. I have copied here a couple of definitions. The first one is the first definition that was proposed on planetary health. It's it's a bit long. Planetary health was defined as the achievement of the highest attainable standard of health, well-being, and equity worldwide through judicious attention to human health systems, political, economic, and social, that serves Earth's natural system limits within humanity can flourish. It's a bit of a complex definition. What is good about this definition is that it already makes clear that it's not only about health and about the environment, but it's also about political, economic, and social systems. And it also has on it the concept of equity, which are key for these concepts are key for planetary health. There have been more recent definitions on planetary health. I copied a second one from the Planetary Health Alliance, which also emphasizes the topic of transdisciplinarity and solution-oriented. So planetary health, it's clearly solution-oriented. But as I said, basically planetary health is understanding that human health and the health of the planet have to go together. Just a parenthesis, some of you might be thinking whether planetary health or One Health are the same thing. Well, planetary health, One Health, it's a field, it's an area that started years before planetary health. As a colleague of mine say, we have the same genotype but different phenotype. So basically, One Health focuses on infectious diseases, and people working on that mainly come from the vet sciences, public health, and planetary health focus more on the challenges of the Anthropocene. But obviously, they are fields that are very much related. Okay, well, we've seen the definition of planetary health. I think definitions are good, but I think that examples are better. So that's why I copied this slide here. This is a 2x2 table. Well, I'm an epidemiologist by training, and we epidemiologists love 2x2 tables. We think it's a very nice way to present results. So this is a 2x2 table, including in one side the health of humans and the health of the planet. No? Human health so far has been followed this approach. So thinking that policies or actions that were good for humans were okay, without thinking if they were good for the planet or not. And two clearly examples of that, it's the use of antibiotics and health systems. When I mean the use of antibiotics, I mean the problems that antibiotics cause on the environment and the problem related to antibiotic resistance, which, by the way, it's the reason I'm not today at the school. But as I said, this is no longer acceptable. And Planetary Health wants that all the actions and policies fit into this cell. This 2x2 table has been prepared by my colleague Josep Maria Antó. And in this paper in this reference here, you have a very detailed explanation of the table and clear examples of policies that fill into each cell. Very briefly, because I think the time is running, I will comment on good for health, bad for the planet examples. And one of the shocking one is health systems. There is no doubt that health systems are good for human health. I don't think I need to justify that. But what probably it's surprising and most of us are not aware is that health systems have a huge impact for our environment. No, the environmental footprint of health systems is between 1% and 5%. Thinking only about emissions. And okay, if we compare that with other sectors, this might not be that relevant. The agricultural sectors contribute globally in about 15% of the emissions, or the transport sector between 15 and 20%. Obviously, a lot more than health system. But if we take into account that health system is meant to improve human health, this percentage or this contribution to the environmental degradation should be smaller. I left here another reference which analyzed the environmental impact of the Dutch health sector, not only looking at emissions, but at other indicators. We don't have time to go into the details of that, but I think it's a nice reference for you to go through it. Okay, now I want to give an example of the good and good. So actions, policies, completely coherent and aligned with the concept of planetary health. And one of the classical ones is the adoption of sustainable and healthy diets. Now, in this paper here, they do an evaluation of the environmental impacts of different dietary guidelines. In the first columns represent different indicators of environmental degradation, emissions, land use change, use of fresh water, nitrogen, phosphorus. And the last column represent NCDs, so non-communicable diseases. So we see that the adoption of all national guidelines would reduce the number of NCDs, no? But for the environmental indicators, they are not that good, especially if we look at environment as in global emissions. The WHO guidelines and the Eat Lancet guidelines, which are guidelines specifically designed to promote healthy and sustainable diets, are the only ones that, apart from reducing non-communicable diseases, are between the limits recommended of environmental degradation. Also, very rapidly, a very nice example of actions completely aligned with the concept of planetary health are explained in this paper here, which explore the links of all the connections between climate change mitigation actions and human health. Now, for all the actions that we should be taking to reduce climate change, they explore the positive effects in different health outcomes. So the concept of benefits, as you might have already identified, is key in the field of planetary health. I don't want to overpass from the 25 minutes I was allowed, but just very, very rapid comment that, okay, it seems planetary health face some challenges, as you know. Aren't we doing that? It seems quite obvious, no? Improve health by improving in a way that we can improve, or that we cannot keep eroding planet Earth systems. Well, planetary health faces some challenges, and some of those challenges refer to knowledge. I start when I presented the concept of planetary health. I said that is clearly a transdisciplinary field. Transdisciplinarity, it's difficult to articulate. I'm sure you will do a great work in the school during this week to improve that. But this is one of the challenges that we face in the field of planetary health. Even if we had all the knowledge, the implementation of the challenges required, it's difficult. We are facing a period of political dividends and science deny. We need transformational challenges. We need those in an urgent manner, in an equitable way. I've included a couple of references that explain that very, very well and in detail. And the third challenge that we face is the imagination challenge. So we need to redefine the concept of human health. We need to involve, and this is related as well to the concept of transdisciplinarity. We need to involve ways of knowledge that have not been traditionally involved in all the discussion. So just traditional knowledge. We need to include sciences or disciplines that have not been traditionally involved, such as arts and humanities, to provoke that these necessary changes. And we need to imagine how we want this planetary stewardship. And just to finish, I leave here like some key concepts or the take-home messages from my super brief presentation. I don't think I need to read them. I will be happy to share the presentation. And as well, I'll give the slides where you have my contact here and the detail of my research group. The website is under construction, but you can see some of our activities in the website of IS Global or on the masters on planetary health. And well, I leave it here with my best wishes for you for the rest of the school, and happy to take questions after the other presentation.